I'm Dr. Dustin McDermott. I'm a robotic and weight loss surgeon at Christus Good Shepherd Medical Center in Longview, Texas. Thank you for taking the time to learn more about weight loss surgery and how our program can help overcome obstacles that has hindered you from losing weight in the past. Here at Christus Good Shepherd, we realize that obesity is a complex disease. It can be costly not only with your health, but your pocketbook. Treatment of obesity-related illnesses can cost a significant amount of money each year in medications, doctor's visits, or treatments that are directly related to those complications of those diseases. We work with your current doctors and specialists in the treatment and hopefully resolution of those medical conditions while you lose weight. I believe that the keys to our success as a program is preparing you to succeed. Patient education is essential, both before and after surgery. Meeting with a dietitian, identifying current mistakes in food choices and how to fix them is only the beginning. Knowing your expectations and setting your own personal goals and being aware of common pitfalls will set you up for a successful outcome. We measure obesity by the body mass index, or BMI. BMI is a value derived from the weight and height of an individual. To qualify for surgery, you must have a BMI of at least 35 with a medical condition of diabetes, high cholesterol, high blood pressure, obstructive sleep apnea, or arthritis of a weight-bearing joint like your ankles, knees, hips, or shoulders. These are diagnoses that you may already have, but can also be made during your workup prior to surgery. If you have a BMI of 40 or more, you do not need one of these conditions. Individual insurance plans may vary slightly on the qualifications, but these are fairly standard. Across the board, a BMI of at least 35 is a requirement. To find your BMI, a calculator is provided on our website. Weight loss has a long list of benefits and can be different for each patient. It could be decreasing medications, resolving diabetes or high blood pressure, or you just simply want to feel better and have better mobility. Many illnesses are related to obesity, but many of them can be reduced with the reduction of weight. There are medications that lower your blood sugar for diabetes and medicines that lower your blood pressure or cholesterol, and even a machine to help you breathe at night for sleep apnea. But none of them can resolve or cure that illness. Surgery for weight loss can eliminate the driving force that has caused the medical condition or is making it worse. Not everyone with diabetes or high blood pressure can be cured, but many can. Each scenario is different and will be discussed at your consultation. Weight loss surgery is not the easy way out. We don't just staple your stomach so you don't eat as much. It's also a metabolic operation. There are hormonal changes that occur that deal with hunger, your drive to eat, and metabolism. Think about your hunger drive now when you go on a diet. You may lose 10 or 20 pounds fairly easily, but what happens then? I bet your hunger and your drive to eat goes up. That occurs from a hormone called ghrelin. Surgery will decrease that hormone that drives us to eat that would normally be very high while you're on a diet. In our program, we focus not only on what you eat, but why did you eat it? We all eat for different reasons. Sometimes it's for boredom, anger, sadness, or even as a reward. If we can recognize those tendencies and patterns, we have a better chance of changing them and forming healthier habits. This isn't going to be a diet. This will be a change in your way of life. We will continue to follow your progress for years after surgery, monitoring your weight, your medications, and vitamin levels, and you will always have access to our dietitian and our support group. There are two surgical weight loss options that are offered, the laparoscopic sleeve gastrectomy and the gastric bypass. Both of these are restrictive procedures. That means that the stomach is altered in such a way that less food is needed to make you feel full and satisfied. Less food, less hunger, means less calories and more weight loss. The sleeve gastrectomy removes the outer curve of the stomach. This is the part of the stomach that stretches when we overeat. The removal of this part of your stomach gives it the size and the shape of a banana. This vastly decreases the amount of food you are able to eat, giving you the feeling of fullness. It also alters the hunger hormone, so your drive to eat while you lose weight also decreases. Although rare, complications can occur. Some specific risks are bleeding or leaking from the staple line. Uncontrolled acid reflux may be a reason the sleeve is not your best option, but having acid reflux does not eliminate the sleeve as a good possibility for surgical weight loss. We will discuss all those options and find what is best suited for you. Gastric bypass is the other surgical option. As well as reducing the stomach size, it also adds a malabsorption component to the surgery, so the body absorbs fewer calories. With gastric bypass surgery, a small stomach pouch is created and a section of intestine is bypassed. This does not allow the absorption of all the calories and nutrients as efficiently. The bypass also decreases the hunger hormone, but not to the extent as the sleeve. There are specific risks to each procedure. There are the same types of risk of bleeding or leaking and can be treated by different methods. Additional risk of intestinal obstruction can occur with the bypass as well. Both procedures have some of the same types of risks, such as bleeding or leaking from the staple line. Additional risks of intestinal obstruction can occur with the gastric bypass. One absolute contraindication to the gastric bypass is smoking. I will not offer the gastric bypass to patients who are currently smoking and would not advise it to patients who are likely to restart smoking after surgery. Ulcer complications associated with smoking are much higher and not worth the risk. Although both operations are safe, they do have their individual risks. If a complication arises, the treatment is based upon when, where, and why it occurred. The risks are outlined in our booklet and will be discussed at your appointment. The sleeve gastrectomy has an average of 62% weight loss of your excess body weight at 1 year. That means if you are 100 pounds overweight, then the average weight loss at 1 year will be 62 pounds. This is average and can be much more if the patient is diligent in the postoperative program. The gastric bypass is 67%. I ask both patients to take a multivitamin after surgery. The gastric bypass will typically require more vitamin supplements but can be adjusted over time as we monitor those levels. Our first visit will outline the pros and cons of each surgery and how it relates to you specifically. The decision on which surgery to have is yours to make. I will guide you and give you input if I think there is a better option. Visit our frequently asked questions section to help navigate your decision. Thank you for your interest in weight loss surgery at Christus Good Shepherd. Our booklet will be provided and made available to you at your first appointment. It contains information that will help guide you through this process. We also offer a monthly seminar with our team discussing the qualifications, surgery, and answering any questions that you may have. Visit our website for seminar dates. Our nurse navigator and office staff are here to help any way that we can. Request an appointment and start the process of becoming a healthier you.